stories trending now on News Radio 570 WSYR, now on 106.9 FM.
Okay, Don, 8:46 now, 14 minutes until the top of the hour at 9 o'clock. Of course, as we mentioned, news and detail at the top of the hour, and then Glenn Beck between 9 and noon. We're joined now by Dr. Albert Pang. Dr. Pang is an optometrist, and there's been a recent study indicating that a particular eye test, an eye examination, can be a predictor of Alzheimer's disease. Doctor, good morning. Is that true? How does this work exactly?
Good morning, Mark. It's true, and actually this is two leading-edge technologies developing to find out to have early detections of Alzheimer's disease. And the first involving the inner surface of the eye called the retina. We believe that there's a certain marker in patients suffering from Alzheimer, and that marker is called beta amyloid, and they can occur in both the retina as well as the lens of the human eyes. So these two technology, one of them is called the retinal amyloid imaging, is to check and see the density of the amyloid marker in the retina, and the other one is to check for the marker at the lens of the human eyes.
Now, the beta amyloid that you're talking about, I mean, that's something that, as I recall, shows up in the brain, in brain tissue.
Yes.
And there have been there are recent MRIs that allow people to see these things. It used to be that you really couldn't diagnose Alzheimer's definitively until after the person had died. Now there are scans for it. I would take it that this becomes a much easier and much less invasive test, a much less expensive test than actually doing a scan or an MRI. Is that correct?
Right. Actually, you're right. Exactly. The cost will be way down because of the fact that you don't have the involved MRIs and all those expensive equipment. It's basically using an in-office scanner to scan for amyloid in the eyes. And then also, I think the biggest advantage of this is really a first step of many steps to really control the horrible effects of Alzheimer's, because if you're able to detect early and take certain precautionary measure, or even later on better drugs, we're able to again control the disease a lot better.
Now, is this particular test, will it give you an earlier indicator than a brain scan, or will it give you an advantage in terms of early diagnosis?
Yes, and this is actually, as far as I know, this is the first in-office test that we're able to detect the disease earlier. And right now, when we diagnose Alzheimer's, basically based on cognitive questionnaire, cognitive tests, to determine whether the behavior or the memory ability of the person have depreciated to a level of consider Alzheimer's. And also, like what you say, using the PET scan to scan for the amyloid in the brain. But this is even before the degenerative process affecting the brain, we were able to see the marker in the eye.
Optometrist Dr. Albert Pang with some news about early detection of Alzheimer's, something that's of importance to all of us as we all get older. The country as a whole is getting older right now. 11 minutes till 9 o'clock.